Growing up, my father was a pediatrician, and so I always thought that would be my route. So after LSU Med School in New Orleans, I got a residency in Jackson, Mississippi. Part of the residency is to do these little mini fellowships that are trauma-based. Some of us got to go to Europe. When I went to Canada and Seattle. Great spots, learned a lot. And then the real fellowship, which is after residency, is when you decide you want to be a hand or spine or foot and ankle or sports or what have you, and I chose joint replacement. And I chose a place in Phoenix. When I picked my first job, I went back to Jackson, had an opportunity to do that, and also maybe even do some teaching with the university where I came from. I think you should get up every day and say, how can I be a blessing? And part of that with the patient is, it's not just making the diagnosis and it's not just doing good work. It's making sure they believe that you care. Really, it's more on this front edge.
It is.
It's not a factory. It's a one patient at a time mindset. I've been doing this for 30 years. And so a lot has changed and is what we've tried to establish from a long-lasting implant. What used to be a 10 or 15-year implant, now we can pretty safely say is probably twice that. We all have stories of our successes with people who snow ski and play racquetball and play pickleball and all these kind of things. Congenital problems where people have been dealing with issues their whole life that you can fix, again, very gratifying. Based out of orthopedics, the precursor to golf orthopedics, from my perspective, was founded by Paul and Flora Fellers. They were very big into medical missions, spending at one time a whole year overseas. So I think maybe one or two, early on when I got here, they invited me to go down to Ecuador. It grew into this one little OR shop above the bus station, this very proficient hospital. It is a medical mission, it is a Christian ministry. Very gratifying. We try to bring as many new people as we can. It's just very fulfilling. And we plan to do it as long as we can. If you're in practice long enough, you'll treat the person or their child or grandmother. That continuity and that connection to the family is special. Wonderful to see your old friend, patient come in and see how they're doing or treat whatever need they have. It's a great relationship.